Australia's definition of being fully vaccinated against COVID-19 is set to change, with people aged over 16 years now only considered up to date with their vaccinations if they have had their booster shots. Key points: people will need to get a booster within 6 months of their primary course to be up to date. People will need to get a booster within 6 months of their primary course to be up to date. The rule will not apply to international travellers coming to Australia. The rule will not apply to international travellers coming to Australia. Those not eligible for a booster will be considered up to date after their primary vaccine course. The Australian Technical Advisory Group on Immunisation, ATAGI, has recommended moving away from the term fully vaccinated. ATAGI's new advice was endorsed by the National Cabinet at a meeting this afternoon, but will not apply to international travellers arriving in Australia. A person is up to date if they have completed all the doses recommended for their age and individual health needs, Health Minister Greg Hunt said. Under the new rules, if it has been longer than 6 months since someone's last vaccine dose and they are eligible for a booster, they will now be considered overdue. All Australians aged over 16 years are currently eligible for a booster shot 3 months after their primary course. People under 16 years of age will continue to be considered up to date after completing their primary course of vaccination, while severely immunocompromised people aged 5 years and older will require a third primary dose to remain up to date, Mr. Hunt said. National Cabinet agreed it would not mandate booster shots nationally, except for aged care workers. But states and territories may decide to implement mandates in their own jurisdictions. ATAGI had flagged it was considering changing the way it refers to COVID vaccinations, saying earlier this month the term fully vaccinated could be confusing. The body's chair Nigel Crawford told a parliamentary committee that changing the term would bring the COVID-19 vaccination program closer into line with other, like those administered to children. We think the best terminology is actually up to date with vaccination status, rather than fully vaccinated, he said. That's a term that we've used in the childhood program. Winter prep underway. Prime Minister Scott Morrison also asked the states and territories to come up with an audit of how prepared each of their health systems is in the lead up to winter and an expected second Omicron wave, paired with the seasonal flu. The audit will be led by the Department of Health, along with the national health body, the AHPPC. Australia's eastern states also agreed to work with the federal government on a plan to restart cruise ships, which have been banned from operating since early in the pandemic. National Cabinet will next meet again in March.